Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the program tonight as Omicron cases continue to surge, we're joined by a panel of India's finest doctors to get an idea of just where we are headed. I'm going to introduce our panelists first. Before I bring you some graphics on why it is that we are discussing this, Dr. Rajiv Jayadevan, Vice Chairperson, Research Cell of the Kerala State Indian Medical Association, Dr. Alok Roy, the Chairman of the Medica Group, Hemant Thakur, Chairperson of the Maharashtra COVID Task Force, Dr. Deep Kumar Debarma, Nodal Officer for COVID Tripura, the State Surveillance Officer in Tripura, Dr. Rama Narasimhan, the Senior Consultant of Internal Medicine at Apollo Chennai, and Dr. Suresh Kumar, the MD of LNJP Hospital here in Delhi. But first, let's bring you an idea of why exactly we are looking at this. So, a number of graphics before we discuss this. First up, look at the numbers. Let's bring up those graphics. 37,379 fresh coronavirus cases have been reported in India in the last 24 hours. That's up 10.75%. In the last 24 hours, there have been 124 deaths, or 0.81%. How many of these are Delta? How many are Omicron? We don't know. But remember, Omicron, the new variant, is surging in our metros plus Hyderabad. The rate of vaccinations down 1.87%. It's at 91,75,000 plus doses, but it's not anywhere near where we need to be. The sooner we are able to vaccinate with 2 doses all of our adult population, it's so much better. Now we are vaccinating kids as well. So let's talk about teen vaccination. That's really good so far. In fact, that's outstanding. As of today, 81,45,038 children on day 2 of the vaccination drive have been, they've been vaccinated with their first dose. That is up a whopping 97.3%. Our children are doing so much better than adults. Tests up 31.32%, as you would expect given the sharp surge in cases that we are looking at this stage. Well, let's bring you a few more graphics. Let's just bring those up to give you an indicator of some of the areas which are worst affected. As you can see over there, there is, if you look at the far right, it's 0.11% up, but in terms of numbers from 1 week back, it's significantly more. It's 37,379 daily cases now, right, on the 4th of January today. A week back on the 28th of December, it was 6,358. So, as you can see, 4 weeks back it was 6,800. It went down slightly, it rose again, and then just look at the massive jump that's taken place in the last couple of days. Let's take a look at district-wise positivity numbers to give you an idea of those areas which are worst hit. This is from the 28th of December to the 3rd of January. Lahaul and Spiti in Himachal Pradesh with 63.64 positivity rate. It's an area with a lot of tourists. Kolkata with 38.37%. That's very worrying. Howrah in West Bengal near Kolkata, 22.3%. Mamit in Mizoram, 21.5%. Kodarma in Jharkhand, 16.79%. Mumbai suburban, 14.3% positivity. Mumbai as a whole, 13.9%. North Goa has a positivity rate of 13.44%. Let's give you an idea of the Delhi situation now, because we are seeing a fairly major surge over here. 5,481 new COVID cases in Delhi. That's up from 4,099 yesterday. A significant jump. Number of COVID positive patients in hospitals has gone up from the 28th of December from 496 cases. It's gone up rapidly at this particular stage to 4,481 cases rapidly. The number of patients on oxygen support, COVID positive patients in hospitals now 482. Then we've got a breakup of mild cases as well, those without oxygen 308. Let's keep changing this. Moderate patients at 168, those on oxygen support. On ventilator support 14, but again, these numbers could in fact be substantially larger simply because the Delhi government's Corona app appears to show many more patients in ICU rooms with ventilator support. Let's take a look at Mumbai in the last 24 hours, 10,860 cases. Yesterday it was at 8,082. So that's a sharp rise which we have seen in Mumbai in the last 24 hours. On the 28th of December, again, as a point of comparison, there were 1,333 cases. These cases clearly on the rise. Today, just a couple of days later, a massive jump from 1,333 cases to 10,860 cases. 834 people have been hospitalized in Mumbai in the last 24 hours. ICU beds and ventilator beds, there are 2,472 in ICU beds, 1,284 in ventilator beds, 9,657 oxygen beds in Mumbai at this stage are occupied. So let me go across first to Dr. Hemant Thakur. Dr. Thakur, the rules basically say that if you do test positive for Omicron post genetic sequencing, you need to go to a certain facility. Given the numbers that we are seeing in Mumbai, where you are, does that make sense anymore, or is home isolation where we are headed for Omicron positive cases?
First of all, you cannot tell so quickly when you test positive,
right,
whether it is Omicron or whether it is a Delta variant. When you test positive, we look at the patient clinically, and clinically, if the patient is mild or mildly symptomatic or only a contact of somebody who is symptomatic, we treat it at home. We treat this as home isolation.
What is the protocol?
We keep the patient.
What is the protocol?
I beg your pardon?
What is the protocol once the samples come back from genomic sequencing?
If the genomic sequencing shows it to be Omicron, the protocol was for patients coming in from the West. We used to admit them in certain centers,
right,
or take them to jumbo centers.
Right.
Given the numbers that we have, and given the fact that clinically we are in community transmission, how many people are you going to put in jumbo centers?
No, so that's just my point. That is just my point. And there's a reason I'm asking that. In fact, let me put that across to Dr. Alok Roy. Dr. Roy, a lot of people, and this is anecdotal evidence, but it's something that people keep telling us, that in Delhi, for example, a lot of people are reluctant to get RT-PCR tests because they feel that if there is an RT-PCR test, the result goes into the system, it goes for genomic sequencing, and they come back Omicron positive, then they'll be put to a center. Even if they have mild cases, they don't need hospitalization, nothing. People don't want to leave their homes. And therefore, a lot of people are doing rapid antigen tests that may show them to be positive, but they want to stay at home. Now, given the numbers that we are seeing, does this policy need to change?
Sir, we have gone beyond the home isolation or institutional-based isolation. There are so many people involved. There are so many people are getting infected. That all those, in fact, I would like to say that if you continue with the quarantine for longer period, you will have no person available to fly the plane, no person available in the hospital to treat patients. So this is a time to review our policy on today basis, not even tomorrow basis. Quarantine has to be addressed, home isolation has to be addressed, and the third most important thing is that how are we going to deploy our manpower in case of crisis? A time will come in next week or so where those who are asymptomatic positive will be called to the work.
Yeah, no, absolutely. And that thanks very much for raising that. We'll talk about all of these points. Dr. Rama Narasimhan, a lot of people want to know what you are seeing clinically. Are you seeing symptoms which are different or somewhat different this time around, which gives you an indicator of what may be Omicron, as opposed to for example, again, anecdotal evidence, I'm certainly not a doctor, a scratchy throat. Is that something which gives you as a doctor some sort of evidence on what it may be?
Like you said, it would, at this point, it still will remain only an anecdotal sort of information. Because we're still fairly early, although we're seeing the surge. Definitely the people who are now testing positive with the RT-PCR, and maybe a few of them who have been confirmed to have Omicron seem to have much lighter or lower risk of complaints and risk of being admitted in the hospital so far. It is usually just a sore throat, like a very, very bad flu, a fever, some body aches, most of whom are doing well at home. And so it's sort of a little heartening in the hope that the Omicron, although it is spreading very fast, and although it is indeed knocking people out for a little bit longer than the flu, hopefully it will replace the more severe Delta variant with this milder sort of symptoms and allow people to stay home without burdening the healthcare system and also the pockets of the individuals and their health itself, and can bounce back. It seems to be affecting more the upper respiratory than the lower respiratory. And you know how the lower respiratory tract, when it was infected, we saw people with long COVID and long delayed problems with it. So the hope is this Omicron variant will indeed spread fast, surge high, and knock people out. But again, let people bounce back and not completely paralyze us like we saw with the Delta wave. That's a hope.
Dr. Jayadevan, would you like to pick up on that point on how a large number of cases which present themselves in Omicron present themselves as upper respiratory tract infections? Again, for our viewers watching this program, does that indicate a potentially milder disease?
Well, at this time, we're getting feedback, all sorts of anecdotal feedback from around the country and from outside about the clinical profile of this condition. But as you correctly said, the scratchy throat is standing out in anecdotal observations. So it is something remarkable about the Omicron. I have here a message from Dr. Patni from Kolkata. He says that in about 70% of patients, he found severe headache. He has treated over 100 such patients. A body ache in half the patients. A few patients had severe backache. Generalized weakness is a common denominator, and that echoes with experience around the world. People feeling fatigued, washed out. And this applies not only to older individuals, but to younger people as well. So it's important not to let it spread so far and wide, because there is a feeling that's been generated that this is a mild condition. Now, mild is relative. What is mild for one person need not be so for another. And I'm getting reports of younger people also coming in requiring IV fluids from exhaustion. So all of these are anecdotal reports. I'm sure when published reports come, we'll have a more clear picture. But I would not take this lightly for two reasons. One, if you take it too lightly, people will continue to mingle and spread will worsen. It is not just the mutations that make the virus spread. It's human behavior. So anything that aggravates high-risk behavior, we must put a curb on that. It is true that the virus is preferentially affecting certain tissues, but remember, those are lab studies and they need not apply to the whole human body. In the lab, they'll look at certain types of tissues which represent human tissue. But when the human body, it's all the tissues put together, it need not work out the same way. But it is true that the overwhelming evidence...
So this is what you've mentioned is, I'll just repeat that, a scratchy throat, a severe headache, a backache, and what else did you mention?
Exhaustion. Severe exhaustion.
And fever?
Yes.
Going
fever
up to?
As well. Yeah.
Is it very high fever?
Yes. High fevers.
So above 102 degrees?
Yes. I don't have the exact temperature.
Again, anecdotal. Because, I understand it's early days. Yes. Okay. Dr. Thakur, there's a question which has come in actually from one of our viewers. In terms of treatment, we see a great deal of consistency as far as treatment is concerned between Delta and what is taking place now, perhaps with a little variation depending on the symptoms. But do monoclonal antibodies, the ones which are marketed in India, work at all? Because as I understand it, there are different sorts of companies manufacturing monoclonal antibodies. It's not the same formula. So what we have available in India, does it work or not?
It's a very good question. What we have in India available just now is the Roche monoclonal antibody cocktail. And that doesn't seem to work too well on Omicron.
I see.
Now, this is a catch-22 situation. The authorities don't want to say this is clearly Omicron. Nobody can swear and say this is Omicron. The cocktail has to be given within the first 3 to 5, maximum 6 days of catching the infection. If you wait for the Omicron sequencing to come, you could have missed the bus. So if the patient argues with us, even when we tell him that if this is Omicron, it would not work. And if he asks you that, what if it is the Delta variant?
Right.
So the fact remains that it's a catch-22 situation. It finally boils down to what the patient wants to opt for. But the Glaxo cocktail, the Glaxo monoclonal antibody cocktail, which is not available in India and which the US is stockpiling in huge amounts, is all active against Omicron. But the current one which we have of Roche is not active.
Right. Okay.
Having said that, the cocktail is not something that you want to give all and everybody. It has specific indications. Even if it is Delta, it has specific indications and it has specific reasons why you should give the monoclonal antibody.
Okay.
Remember, the monoclonal antibodies were given to Donald Trump when he was 75.
Right.
So you cannot give it over the counter without batting an eyelid and looking at the science.
Got it, doctor. Got it. I want to go across to Dr. Deep Kumar Debarma, the nodal officer for COVID in Tripura. Dr. Debarma, as a medical practitioner whose cause in life is to save lives, is it not immensely frustrating for you to sort of see the Prime Minister and a large number of people in gatherings, as you saw today in Agartala, which could be a potential super spreader event? Even if it's not that, people would possibly fall sick. How do you deal with that as a doctor? Dr. Debarma, go ahead. I think you're on mute, sir. Can you unmute yourself, Dr. Debarma? No, I press the button again. I think we'll be able to get you. Yeah, go ahead and say something, sir. All right, we'll try and fix your audio, come back to that important question. I hope to get an answer to that. Dr. Suresh Kumar, MD of LNJP, joins me at this stage as well, here in Delhi, one of the largest hospitals in Delhi. So, Dr. Kumar, I was just going through the Delhi government's Corona app. And, we all say that, Omicron, mild, this, that and the other. But at the moment, updated at 9:10 p.m., which is 8 minutes back, COVID-19 ICU beds with ventilators, there are 63 which are occupied in Delhi. On the 27th of December, when I looked at it last, there were 10 which were occupied, right? It's a big jump already. Is this your worry that given comorbidities among senior citizens, others, so many Indians suffer from heart ailments, diabetes, etc., even the most serious cases, ventilator requirement, oxygen requirement, may overwhelm what is available in our hospitals in Delhi?
Definitely, it's a big worry. We have seen that the patient with the chronic illnesses, particularly cancers, neurosurgery patients, pancreatic patients, diabetic patients, coronary artery disease patients, if they are infected even with the milder Omicron variant, they require ICU support and they require hospitalization. We have seen that the patient coming to us from airport, out of 140, we have successfully discharged more than 110. But these patients were healthy because they were the international travelers.
Right.
And on the other side, if you see the patient in the hospitals coming to us, they are either Delta or Omicron, and both are requiring hospitalization if they are having associated illnesses.
No, but doctor, my question is this.
Patient who are,
doctor, I'm just trying to
dialysis.
understand, Dr. Suresh, Dr. Suresh Kumar, I'm just trying to understand oxygen requirement, given the fact that 75% of cases now in Delhi are likely to be Omicron, as stated on this program last night by Dr. N.K. Arora of Entagi, which rolls out vaccines in the country. So if we are looking at 75% plus Omicron cases in Delhi, the question is specific to Omicron. Are you seeing a greater requirement for oxygen in your hospital?
you see, if we compare with the Delta, the last wave, where the oxygen requirement was in almost all the patients, because we have seen in the Delta, most of these younger patients, healthy patients, were requiring ICUs.
But I'm asking you, is it rising now with Omicron?
Variant,
I know you can't
Omicron
compare it with
variant,
Delta. I'm asking, is it rising?
Yeah, definitely rising. It is definitely rising.
And so that's the worry, no, Dr. Kumar, that it's
definitely,
rising.
Definitely.
And given the number of cases that are being projected,
definitely in the coming days,
overwhelm.
more and more beds would be occupied, and more ventilators, ICU beds definitely we require.
Dr. Debarma, we've got you back. Could you answer that question? In Agartala, the Prime Minister, so many others in massive super spreader events, how do you deal with that?
Definitely, as a medical practitioner, it is a matter of definitely a concern, because the protocols which has been developed by the government of India, it has tried to follow, but in certain areas it has not follow in proper ways. So one thing positive is that in Agartala, the main program was held today. The positivity rate of Agartala is around less than 1% positivity rate. Right. And as of now, the variant of that is Omicron, it is not yet detected in the state. As of now, the samples sent to the genome sequencing, it is not found yet. So we are hopeful that event may not lead to such a huge spreader event.
Okay.
But definitely, as a medical practitioner, it is a matter of worry for us also.
All right.
So we are dealing on it. Hopefully, we'll find it out a way.
Okay. Running short on time, so let's just deal with perhaps the issue which we really should have started this program on, boosters. Dr. Narasimhan, even if we roll out boosters right now, and we are able to inoculate all the eligible people in our country miraculously, it would still take 14 days for them to boost their levels to something which might actually help fight Omicron. That's not going to happen. The fact that we have delayed the booster rollout for all adults, I'm not just talking about doctors and frontline workers, is that going to have a major consequence on all of us in this country?
Unfortunately, my answer is going to be yes. I think we were a little lackadaisical and slow on catching the booster on the right scheme of things, not only because it was late with respect to the surge of Omicron cases, but also because we've given a larger gap between the first two doses and what's now called the precautionary dose, not the booster dose, by the government of India. So I think we are definitely a little delayed. Having said that, I mean, what other armamentarium do we have? I mean, we have to go ahead and take the booster and hope that whatever benefit it might afford, we have that benefit. But yes, I think we are a tad bit late.
Dr. Roy, would you like to come in on that? That every minute that we keep delaying boosters, we are only harming ourselves. We keep talking about Indian science, and I'm sure our science is great. But if our science doesn't work to a particular schedule, then we end up harming ourselves. The entire world over, boosters are being rolled out. We are still thinking about it.
Sir, the science is subservient to politics, very unfortunately, in our country. If the entire world was giving booster, we were thinking and talking about it. And we are going to pay the price in terms of essential healthcare workers and essential services falling down. In next 1 week, there's going to be mayhem. I wish we had given booster a month back. That's as in plain and simple language and words.
Dr. Thakur, one final question to you on boosters. Same question. As we delay a booster rollout, let's forget about doctors only and frontline and comorbid. I'm talking about all eligible people because we are a large country. How are we harming ourselves?
I've got patients who have come in and taken consultations after the booster, which they took somewhere else. I've got patients testing positive after 2 shots. And the clinical difference between somebody who had 3 and somebody who had 2 is not much different. Mm-hmm. So theoretically, your question may be well phrased, but on the ground, the clinical symptomatology of a person with 2 shots and a person with 3 is still the same.
But the number of people with 3 shots getting the disease is far lower.
Yeah, well, there are not people who have got 3 shots. Overseas, we found that people, even with 3 shots when they began
but
in
the
October,
large number of people with 3 shots are protected. Look at the situation in London, for example, where they boosted pretty much everyone so far.
I agree. The number of people who are protected with 3 shots have absolutely either nothing in positivity or mild positivity.
Right.
The same thing goes here. People with 2 shots when they are coming, 90% or 95% of my patients are after 2 shots. And they are all mildly symptomatic. I want to be optimistic that, as somebody rightly put it at the beginning of your show, who's going to drive your car? The Maharashtra government today has said healthcare workers, after 5 days of testing positive, can come back to work, because we need the nurses and the compounders and everybody and the doctors to come back to work.
And that's a big worry, because they may still have some they may not be negative for COVID.
Well, we'll have to also see what CDC says. CDC says it's fine. London says 8 days. Others say 10 to 12 days.
Yeah.
We are thinking on our feet according to the necessity.
Okay, Dr. Thakkar, I'm going to have to interrupt you, because this is one of the unfortunate parts of television when we run out of time. But we will have to continue this conversation at a later stage. I'd like to thank you all very much for joining us. A couple of questions which have come in. Amit Talwar says, very drastic. Please do not leave your house without any important work. Staying home will be safe for you and your family members. Deepali Sinha says, the severeness of the 3rd wave will be totally dependent on the symptoms of the variant. A couple of points over there. A lot more coming up. Stay tuned.